Heavy periods? Bleeding between cycles? It might be more than just hormones. Let's decode abnormal uterine bleeding, its causes, warning signs, and when to take action. AUB equals any irregular bleeding. Abnormal uterine bleeding refers to any change in menstrual flow, volume, timing, or frequency that affects quality of life. It's categorized using the PALM-COEIN system, a globally recognized diagnostic tool.
PALM-COEIN classification. Let's break it down. PALM, structural, P, polyp. A, adenomyosis, L, leiomyoma, fibroids, M, malignancy, hyperplasia, COEIN, non-structural, C, coagulopathy. O, ovulatory dysfunction, E, endometrial, I, iatrogenic, N, not otherwise classified. Clinical presentation. Symptoms may include heavy menstrual bleeding, bleeding between periods, post-coital bleeding, irregular or prolonged cycles, anemia-related fatigue or shortness of breath.
Diagnosis. Diagnosis includes history, physical exam, and tests. CBC, coagulation profile, hormone panel, FSH, LH, TSH, prolactin, pelvic ultrasound. Endometrial biopsy, if greater than 35 or high risk, Pap smear.
Treatment. Treatment depends on the underlying cause, age, and fertility goals. NSAIDs and tranexamic acid, hormonal therapy, OCPs, progestins, IUD, treat underlying condition, fibroids, polyps, surgery, endometrial ablation, myomectomy, hysterectomy in select cases. Complications and prognosis. Left untreated, AUB can cause anemia, infertility, endometrial cancer, especially with hyperplasia. The good news, most cases are manageable with the right approach.
A 36-year-old woman presents with heavy menstrual bleeding for the past year. Her periods are regular but last 8 to 10 days with clots. On pelvic exam, the uterus is enlarged and irregularly shaped. Ultrasound shows multiple intramural masses. What is the most likely cause of her symptoms? A, adenomyosis. B, endometrial polyp. C, uterine leiomyoma. D, ovulatory dysfunction. E, endometrial cancer. Explanation. An enlarged, irregular uterus with heavy, regular bleeding is characteristic of fibroids, leiomyomas, a structural cause classified under P in PALM-COEIN.
Question. A 19-year-old girl has irregular, unpredictable periods ranging from 21 to 45 days apart. She is overweight and has signs of acne and facial hair. Labs show elevated LH, FSH ratio and anovulation on charting. What is the most likely cause of her abnormal uterine bleeding? A, polyp. B, coagulopathy. C, ovulatory dysfunction. D, iatrogenic. E, endometrial hyperplasia. Explanation. Polycystic ovary syndrome, PCOS, causes anovulatory cycles, leading to irregular AUB and is classified under the O, ovulatory dysfunction, group.
A 42-year-old woman presents with painless, light intermenstrual spotting. Her cycles are regular otherwise. Speculum exam shows no cervical lesions. Transvaginal ultrasound suggests a focal echogenic mass in the endometrial cavity. What is the next best step in management? A, begin combined oral contraceptives. B, endometrial biopsy. C, hysterectomy. D, polypectomy via hysteroscopy. E. Empiric NSAID therapy. Explanation. AUB with a focal intrauterine mass suggests an endometrial polyp, best managed with hysteroscopic removal.
A 55-year-old woman presents with vaginal bleeding for the first time in 5 years since menopause. She is obese and has diabetes. Pelvic ultrasound reveals an endometrial thickness of 9 mm. What is the most appropriate next step? A. Hormonal therapy. B. Pap smear. C. Endometrial biopsy. D. Pelvic MRI. E. Watchful waiting. Explanation. Postmenopausal bleeding with endometrial thickness greater than 4 mm warrants endometrial biopsy to rule out hyperplasia or malignancy.
A 15-year-old girl has had heavy menstrual bleeding since menarche. Each cycle requires double protection and lasts greater than 7 days. There is a family history of nosebleeds and easy bruising. Her labs show low hemoglobin and prolonged bleeding time. What is the most likely diagnosis? A. Polyp. B. Von Willebrand disease. C. Endometrial cancer. D. Anovulation. E. Fibroid uterus. Explanation. Adolescents with menorrhagia since menarche and bleeding history may have coagulopathy, especially von Willebrand disease, classified under C. A 28-year-old woman recently started depot-medroxyprogesterone acetate injections for contraception. She now presents with irregular spotting for 3 weeks. Physical exam is normal. Pregnancy test is negative. What is the most likely cause of her abnormal bleeding? A. Endometrial cancer. B. Ovulatory dysfunction. C. Polyp. D. Iatrogenic cause. E. Fibroid. Comment your answer below. Final message. Your menstrual cycle is a mirror of your health. If it's abnormal, don't ignore it. Get evaluated, get treated, and share this video to raise awareness.
Exciting news from Dr. DC Online. We're launching free live classes to support students preparing for USMLE, FMGE, PLAB, and NRE. No fees, just pure, high-yield medical education from trusted educators. Subscribe to DrDC_online on YouTube and follow us on Instagram and Facebook. Let's grow, learn, and succeed together.